This week on Africa Health Check.
Some people don't actually believe in the vaccine. I still think that people should take it because it gives you a fighting chance.
Certes qu'avant on pensait qu'il n'y avait pas des traitements curatifs pour cette maladie, mais aujourd'hui on sait déjà qu'avec les vaccins on peut éviter les pires.
We review how experiences from past endemics,
the same techniques that were used to bring the yellow fever under control in West Africa,
are being used to combat the present. Welcome to Africa Health Check. This is the show that reflects on Africa's response to the COVID-19 pandemic. I'm Khokhontlejang Paladi. On today's show, we will be discussing learning from past pandemics in combating COVID-19 pandemic. But before we get into the discussion, let us have a look at Africa in numbers. This week's Africa in numbers, we look at the average number of new infection rates as of the 20th of December 2021. There have been over 9 million reported infections and approximately 226,000 reported deaths caused by the coronavirus in Africa so far. From the latest 7-day infection averages reported by each African country, South Africa has recorded the most new infections, leading with slightly over 20,000 new infections per day, followed by Zimbabwe with 3,810 new daily infections. Eswatini and Kenya follow with slightly over 1,000 new daily infections, and Nigeria closes the top 5 with 918 new COVID-19 infections per day. And that is our Africa in numbers for this week's episode. As I've already said, this week we will be looking at tackling past pandemics in Africa, what we can learn to use in our COVID-19 response. But before we get into the discussion, I want to introduce our panelists for this discussion. As usual, I have joining me Dr. Marianne Moreithi, who's the current chair of Department of Medical Microbiology and Immunology and a senior research fellow at the University of Nairobi in Kenya. We also have Reverend Anthony Achampong, who's a pharmacist and a pastor from Ghana, and those are our regular commentators for this show. Our special guest for this episode will be Dr. Essel, who is the Municipal Director of Health Services for Ghana Health Services. But before we hear from these experts on the experience on tackling endemics, let us have a look at our feature story for this week.
My name is Oyewale Tomori. I'm a virologist from Nigeria. I live in Ibadan. I've retired now, but I still provide advice to government on disease outbreaks and epidemics, both at local level and at international level. I worked as a virologist at the University of Ibadan for quite a long time, and we're involved with the investigation of disease epidemics throughout the whole country, wherever they occurred. When I joined the WHO, my work was mainly with polio eradication, in which we are providing the laboratory backup for all of the outbreaks that occurred in Africa. But in addition to that, I was also the virologist for the entire African region, in which is wherever there was any outbreak of Ebola, of yellow fever, Marburg disease in different parts of the continent, I also participated in investigation, bringing the experience of the past into advising both the Nigerian government and also the WHO regional sector. If we're not consistent with the routine immunization and others, then the epidemic kept surging. The same techniques that were used to bring the yellow fever under control in West Africa is now being put into use. Now, let's talk about Lassa fever. Lassa fever was first discovered in 1969 in Nigeria. Since then, we've been having epidemics of Lassa fever going on in different parts of West Africa. Again, other diseases that people know about, cholera is common all over the whole place. We must not forget Ebola. Ebola was first started in DR Congo, and we didn't hear anything about it in the western part of Africa until 2014. COVID-19 is a new disease which we're learning on a regular basis. It's a disease that's coming up with different, some kind of elusiveness and evasiveness, which is quite different from the previous disease that one had been involved with. I mean, what we knew about COVID-19 at the beginning is not what we know now. There will be new information that has come about it, better understanding of the disease compared to what it was when we started in 2019. Because of the past experience with other diseases, one is learning along the line as the disease reveals itself and then trying to combat it. I think the most important thing for us is a good, reliable, robust disease surveillance. Disease detection, and proper response. Once you're able to detect what you have, then you know and identify what the problem is, then you know what action to take. We see what has happened with COVID-19. Because when it came, it brought the world economy to a standstill. All of the things that we achieved in the past, was destroyed by just one disease. Therefore, I think we need to learn a lesson that it is better to prevent it, have a system in place that will quickly detect it. An epidemic that usually starts with one case, and if you don't catch it on time, it becomes a major epidemic. You need system to detect what is happening. You need system like telephone system, the GIS, and other things to be able to report what is happening in very remote areas of our country, so that those in a position to act can take the proper action. The one issue that we need to look at, particularly in Africa, is the fact that we need to develop capability into a point where we're not so dependent on other parts of the world. Yet we have all the talented people in the African region. However, our governments must create the enabling environment, that enabling environment for the talents we have in Africa to function maximally, so that they can be part of the contributors to the solution to COVID rather than consumers of the product of other countries.
A really powerful and inspiring story in Nigeria. I certainly hope that we've learned a couple of things from our feature story. And now we're going to go straight into the discussion. And I want to start with Dr. Essel from Ghana. Dr. Essel, would you please kindly introduce yourself, tell us where you're from and what you do?
So I'm Dr. Essel, a Ghanaian, and I work as a public health physician specialist. I'm the Municipal Director of Health for the Ghana North Municipality within the Greater Accra region of Ghana. My experience in public health has been for about 4 years now. I've worked in MDR TB management, I've worked in research, I've also worked in advocacy, and then also as a health authority for about a year and 5 months, yes.
Maybe you can share your experiences in tackling past endemics and how that was helpful in your contribution towards the COVID-19 response.
Okay, so prior to the COVID-19 pandemic, I had minimal experience with pandemic response, and most of my public health work was in the line of surveillance and health education. But when we had our first cases recorded in Accra, they were kept at the Greater Accra Regional Hospital, where I was working and where I worked at the isolation center, which allowed me to have experience in case management and contact tracing, and then also in risk communication. And all of this too, we've been doing monitoring as health authorities. So the other thing we do is to ensure that the facilities within the municipality are sticking to the national protocols and then are working with us on pandemic response at whichever level we are. Currently, we are at the national immunization level, where we are doing a national campaign. The month of December has been declared a vaccination month, and despite 6 campaigns that we've done nationally, which are all managed at the municipal level by the Municipal Health Directorate, we are also embarking on a larger scale, hoping that by the end of this, we'd have done 10 million more Ghanaians. At now, we stand about 6 million Ghanaians vaccinated. So that is a bit of what we've done with regards to pandemic response. But however, we are still doing case management and contact tracing, as well as testing within the communities and linkage to care.
And in terms of early detection and timely response, what kind of investments do you think African countries need to make to enhance the capacities?
Okay, so it relies on our health information systems. and then strengthening surveillance systems. But what I've noticed, particularly for my country, which I can speak for because I work in the Ghana Health Service, we have a very strong surveillance system in place. And following the pandemic, we've had a series of capacity building sessions. We've had capacity building workshops where we've trained other healthcare professionals to know how to monitor and look out for cases in facility, that's facility-based surveillance, as well as community surveillance. So the surveillance is done on these different levels, allowing us to fish out cases quickly. This combined with the strengthened health information system will allow you to relay these responses quickly to the regional level and also to the national level.
Absolutely, and I totally agree with you, Dr. Essel. I think one of the things that keeps on taking us back and leaving a lot of room for worry about COVID-19 is how the virus mutates. You know, we've moved from Delta variants to now Omicron, and this really is a worry. What would you say has been your level of preparedness as Ghana for future variants?
So the emphasis on vaccinating and making sure that we attain herd immunity is one of the key things we have put in place. The other thing that I think is very important is the fact that we are really enforcing this vaccination mandate. For now, you'd have to show your vaccination card to get entry to certain programs. There will be the need to show proof of vaccination status before entering the country. And citizens who come back to the country from the 12th of December, now it started, will have to show proof of vaccination or receive the vaccine at the airport before entering the country. We are also still maintaining the 72-hour PCR testing prior to travel. So I believe these are boost herd immunity prior to now is the fact that vaccination is going on at all government facilities. Unlike previously, we had 6 national vaccination campaigns already done from March. But now what we are doing is in all government facilities, and in private facilities, some private facilities, vaccination is going day in, day out, weekends, weekdays, holidays, vaccines are available. And now we have more vaccines available than previously. We have Moderna, we have AstraZeneca, we have Pfizer. So people actually are spoiled for choice when they report to vaccination sites.
And congratulations to the government of Ghana for increasing your reach to everyone in the population to ensure that they have an opportunity to get vaccinated. And let me now go to Dr. Mary. And what would you say has been your experience in tackling endemics in Africa? And how has that experience helped you to contribute towards the COVID-19 response?
This is an interesting topic. And I'm happy we are discussing it because we've been chasing pandemics and disease-causing pathogens for many years. Some local newspapers and local publications normally call us the virus hunters because we've been looking at viruses for a very long time, particularly the ones that may cause pandemics. One of them being Ebola, another one chikungunya, dengue fever. We've been monitoring fevers and other indicators across the country and also across the borders within Kenya and also within East Africa. We are a community of researchers. We've identified what animals, where these viruses are residing. And we have formed a way to communicate with the policymakers, gatekeepers who help address and shape how we respond to the pandemics. And it's because of this, I believe, we were somehow prepared for this current pandemic that we are facing because we had the infrastructure, we were surveilling the population, the environment across our borders. And I want to believe Ebola and the others had somehow prepared East Africa and also the sub-Saharan Africa to face this COVID pandemic. And you can see, again, the evidence from the numbers that we've seen across Africa and other indicators. So we have been doing this. We are tackling even the next pandemic that may come. And we have learned quite a bit of lessons on how to quickly set up infrastructure, create warning, and also work with government and other policymakers to make everyone aware of how to face them.
Absolutely. You're talking about infrastructure needed for timely response. What would you say in the most urgent and as well as the long term, the kind of investments that we need to ensure that our response mechanisms are effective and efficient in responding to endemics?
So infrastructure comes in many ways. I know you're probably thinking of ICT. That's very important because we should be able to track and place this warning infrastructure in places such as mobile, such as SMS services, in that if you develop a fever, if you develop some certain symptoms, quickly press this number so that is disseminated to the people that are receiving it. So that's one. ICT infrastructure is key. Another one is also developing trust within the community that we should be able to communicate with them very clearly and also them communicate to us. And then with that trust, we should be able then to communicate with the government, with the policymakers, with the health ministry, to be able then to set up structures within the hospitals, structures within the borders. Should we up our surveillance within the borders, check temperatures, check who is coming in and out, check also with the public health services, check maybe animals that are portraying some certain symptoms. The people that live within, that are close to these animals, are they having this warning system to be able to report anything that is unusual? With that now infrastructure of trust, very clear communication, and then very quick response in terms of containment measures can really, really go a long way. And you can see that within our setting, once this pandemic was reported across other continents, our government was able to quickly put a border patrol. Surveillance was up. We were able to track our numbers as quickly. We shut down, which again had some negative effects, but also ultimately positive effects of lowering the numbers, COVID numbers within our setting.
Thank you, Dr. Mary Ann. And maybe then just to bring in Reverend Achampo, maybe you can also share your experiences as well.
Pandemics have been part of human existence from history. We can talk about the Asian flu of Spanish flu of 1918, 1920. Can talk about the Asian flu of 1957, Hong Kong flu of 1968. Africa has had her own share of these pandemics. You can talk about HIV, you can talk about cholera, can talk about Ebola, and now COVID-19. History has taught us that when these pandemics strike, there has been increase or an improved search for knowledge about the pathogens and their mode of transmission. That is one major thing that history has revealed to us. Secondly, there are public health awareness and campaign to help all the masses and rise up to the challenge. And there have been ways to deal with them, finding medications, pharmaceutical companies, and traditional scientific have all cashed in as a way of trying to deal with the situation, one of which is vaccines. Then there is in fact, everybody is involved. Everybody is involved. We all have a shared responsibility, shared obligation to want to live in an environment that is peaceful, that is safe, that is healthy. So this has been the story from history, and Africa is part of the search for this ideal situation for our people.
Indeed. I'm going to just quickly jump to Dr. Mary Ann. COVID-19 is mutating. Omicron was discovered in Africa, in South African lab, to be specific. Is this an indication that our infrastructure is improving in terms of early detection, research, and so on and so forth?
Thank you very much. And as you can see, yes, Omicron was first described within by fantastic scientists in Southern Africa, Botswana and South Africa. And that really alludes to how much science, how much research and infrastructure and capability African scientists have. And I'm really excited to see the future in this, particularly even when it comes to vaccine manufacturing locally, so that we do not have to depend on donations and the Western world. But in terms of mutations, again, it also shows that we're actively doing genome sequencing, trying to see what else is circulating, how fast the variant is also circulating and mutating. And as Dr. Essel has said, the only way we can get ahead of this virus is vaccination, because if we have people who are not vaccinated, it creates an opportunity for this virus to infect and also mutate. So that's why we need to up our game in Africa to have everyone vaccinated and vaccinated timely. And that's the only way we'll be able to get ahead of the variants. So it creates no opportunity for that virus to infect anyone else because of the protection generated. But kudos to the African scientists. Again, we need more funding, more infrastructure to be able, even again, as I mentioned, to manufacture vaccines and also detect any other viruses that may cause pandemics.
And isn't it ironic, Dr. Marianne, Dr. Essel, as well as Reverend Achampon, that instead of getting kudos, as you were saying, or a pat on the back, that we were able to pick Omicron, we actually got a travel ban?
Yes, it is. My opinion is it was quite discriminatory. You could even use the word racist, because, again, instead of the kudos, was very severe travel bans that have a huge ramifications, tourism, travel, and so many other factors that may be affected. And this is where we need to act as one global village, one global community, because ironically, Omicron was detected in Australia, Belgium, Netherlands, almost at the same time, but the people who got punished was the African continent. But that is now being reversed, because it also goes back to understanding the science of variancy. If we detect a variant or a mutation in one area, it means it could have spread in every other country. And this is also a lesson for the Western countries to up their game in terms of genome surveillance, genome sequencing, detecting, and also being honest with their data. Because now the other down effect of these bans is that if we discover another variant, we may hesitate in alerting the world and alerting our citizens because of the repercussions that this may cause. So this is a lesson that we need to learn. We also need to develop trust and work as one scientific team and as one community.
Thank you for that, Dr. Mary. And we are going to continue this conversation on the other side, but now we're going to take a short break and hear the word on the street.
My advice to the youth, and not just youth as well, to my fellow Nigerians, is that everyone should please make sure that we abide by the protocol of COVID-19, and we should always keep on praying and believe that one day, it will surely go, because nothing lasts forever. COVID did not come to stay, it's just for a while, and it has come to teach us some certain things about life. So I believe that one day, next year or probably very soon, it will go and it will become a story like the Ebola disease that we have experienced before.
Le plus important que moi je pratique, c'est de pouvoir renforcer mon système immunitaire à base des aliments que nous mangeons ici chez nous. Si vous renforcez votre système immunitaire, ça vous permet de résister à cette virus et à beaucoup d'autres maladies qui peuvent survenir dans cette période de cette pandémie.
Like Nigeria, we've never taken anything serious. Even though we are seeing it, as far as it has not gotten to us, we don't care. People, I do believe it, but it gets to some stages I don't even believe it, because the way the government are even doing it.
And that is the word on the street. We're going to now go straight into a conversation to wrap up with our commentators as well as our special guests for this episode. Remember, we are talking about past experiences from endemics in Africa and what we have learned and how we can use that experience in the COVID-19 response. I'm going to go back to you, Dr. Essel, with the experience that you have from your field and all the work that you've conducted that you talked about. What is your your message to somebody listening to this on the importance of vaccinating?
So currently, we all wish that this pandemic will end. We all want to go back to normalcy fully. But until we've gotten rid of the susceptible individuals, or we have attained herd immunity, we are always going to stay in this vicious cycle of emerging new variants and having to fight it. We get frustrated when we hear this, but we all have roles to play. There are vaccines available. We are ensuring that we are sticking to protocols, but that alone is not sufficient, because a susceptible individual means the virus can still circulate in the population and the virus has room to mutate. So what we are trying to get rid of now is susceptible individuals. That's where vaccination and being immune to it comes in. A large number of people have mild adverse effects, and let's not forget, even regular medication, drugs, paracetamol, have side effects. So we shouldn't blow out adverse effects following immunization out of proportion, whilst overlooking the regular, the known side effects of medication, other medical procedures, which we go for routinely every day in, day out. We're in hospitals, we take over-the-counter medication. All those have side effects. Let's not focus so much on that and look at the global benefits to us all. In the past, we fought other pandemics with immunization. This is not the first, and this will not be the last, given the way viruses and pathogens in general behave. Right now, the vaccines are available. We have this wide variety. Everyone has to be on board. Everyone has a role to play so that we go back to normalcy and we live life as we want to.
Absolutely. And maybe just briefly, before I release you, Dr. Essel, I think one of the concerns is that we want to go back to normalcy, but there's also the worry of the mutation of COVID-19. As a healthcare practitioner, would you say it's safe for us to relax the restrictions and go back to normalcy, even as we are receiving new variants?
So currently, we can't go back to normalcy at all. For this part of the world particularly, we've not really benefited from vaccines as much as other parts of the world. You know, at the beginning, countries were buying the vaccines and purchasing, but you know, over here, a lot of donor support comes in for us to get vaccines. Global Alliance of Vaccines and Immunizations, Gavi, is one of our major vehicles for getting vaccines to this part of the world. We do not purchase most of our vaccines. So there's been some delay in us attaining the level of immunity that other countries have been able to attain by virtue of their mass vaccination exercises. So we are far from it. We need more time, we need more donor support, we need more health education and SBCC to get people to accept the message, understand that this has worked in the past. This is not the first of its kind. This will also not be the last. And we just embrace it and work together in whatever capacity that we can to make sure that we attain herd immunity. We get the population, the susceptible population out, and now we have a population that is protected. And then we can now look at relaxing restrictions. But we know the vaccination itself is not even 100%. It's not 100% protection. So and we have a break in circulation, and we can get to the point where we know that we are not recording cases, and it's just the surveillance system working to look for cases.
It is indeed a collective effort. Thank you very much for that. And thank you, Dr. Essel, Dr. Marianne, and Reverend Achampong for making time to have a really enriching and thought-provoking conversation. COVID was unexpected. A lot of efforts went into the response, and let us give credit where it's due and let us exercise accountability where it is necessary. Thank you for joining us, and make sure you connect with Africa Health Check, same time, same place, every week, and connect with us on our social media platforms. I take this time to wish a Merry Christmas to everyone who will be observing, and pleasant holidays to everyone else. Thank you very much. The future is Africa. The future is today.